Hi everyone, welcome to this panel on Incentivize Early Warning for Pandemics, a solidarity mechanism for fair benefit sharing. And if the title seems opaque or complex to you, don't worry, the whole session will be dedicating to trying to understand what that all means. I'm not sure entirely what it means, and so we'll have a fantastic panel to help us discover what it is exactly. My name is Justin Weiss. I'm the Director General and the founder of the Paris Peace Forum. We have a partnership with the World Health Summit that has been running in the past few years, but it's the first time we are actually doing this panel with the World Health Summit. This also means I'm not a specialist of health issues, and so I will be asking all of you, the panelists, candid questions, but also to the public. Because as I said, the idea is to try and explore what fair benefit sharing actually means and how it can help us get towards not only a pandemic treaty, but a better organization of global health. And I'm sure there's a lot of expertise in the room, and so we'll be tapping into that expertise in the second half of the panel with questions. I want to say thank you to my team at the Paris Peace Forum. I want to say thank you to the team here at the World Health Summit. Obviously, you know that the World Health Summit is largely a Franco-German initiative, and so that's another example of this. For those who don't know the Paris Peace Forum was created in 2018. It's basically two things. It's an annual event happening every November 11 in Paris, in a multi-actor setting with heads of state and government, the private sector, civil society, NGOs, foundations, and others around issues of global governance. And so we're trying to tackle complex global governance issues and complement the work that the UN is doing by creating a coalition, multi-actor coalition, action coalitions, if you'd like, that we work on. And that's the second thing. We are also a policy organization working on health, on climate, on digital issues, and also on outer space issues around the year, using the November event as a moment to leverage that work and trying to get some results and some impacts on norms, political mobilization, etc. So let me introduce the speakers in the order in which we will start the discussion. So right next to me is Katharina Böhm from the WHO, where she is Assistant Director General for External Relations and Governance. So welcome, Katharina. Next to her is Siam Elamoumi from Ginkgo Bioworks. You're Director of Translation. Can you tell us a bit more about what you're doing?
Of course. As Director for Translation, I sit with the Biosecurity Technical Platform Unit, and I support the program design and the technical launch of our genomic surveillance programs.
Thank you.
Pleasure.
Next, at the very far right here is Dr. Magda Robalo, who's a former Minister of Health for Guinea-Bissau, and currently the president and co-founder of the Institute for Global Health and Development in Guinea-Bissau. Then next to her is Francesca Colombo from the OECD, where she is the head of the health division, OECD in Paris. And last but not least, Anne-Claire Amprou is the ambassador, the French ambassador for global health at the Ministry of Foreign Affairs in France. So before we get to the panel, just I want to say again that we'll have time for Q&As. And one last word, especially directed to guys in the room. So believe me, I tried to defend the patriarchy, but I failed. So it's an all-female panel. So all I could come up with was to find a token male moderator. That's me. Even though I'm starting to wonder what my gender is. But anyway, so because of that, or thanks to that, I promise a panel free of man-interrupting, except perhaps by me, and that's probably for the better. So let's get to the issues and jump right in. As the COVID-19 pandemic showed, access to genetic sequence data is crucial to responding early to an health threat. And we saw that variant after variant. While data used to develop new medical products often comes from scientific institutions in the Global South, it rarely leads to compensation and access to medical countermeasures needed to fight a pandemic, or to a reinforcement of those very surveillance institutions that provided the genetic sequence data in the first place. And that, of course, is not just unfair, it's also ultimately counterproductive for everyone. And so that was an inequity that was striking during the COVID-19 pandemic. And so the need for fair benefit sharing is identified as a critical issue for pandemic preparedness in the current negotiation for a pandemic treaty. Obviously, the dynamics governing scientific discoveries are complex, and a destabilization at one level can have an impact on the whole chain. This is clearly a weak spot in PPR, and we need to maintain a strong and functioning chain from the very early detection of assets, be it pathogens or talents, to their full potential. However, and that's where things get complicated, negotiations around these notions are difficult, not least because the terms are not agreed between the various parties. At this stage, and that's what I was saying in the very beginning, we have no common ground on the definition of fair benefit sharing, the benefits themselves, what they consist of, or the difference between these benefits and solidarity. Before any real political progress can be made, it seems necessary to agree on the terms and principles of the discussion and to speak the same language. And that's what we will be trying to do during this panel. So we'll be asking very straightforward questions. What is fair? How do we identify benefits? What types of benefits are we talking about? How to achieve solidarity? What is necessary for the system to work? And we'll ask participants to contribute to the conversation through their personal views, given their extensive experience in that field. And I hasten to say that they will be speaking mostly in the personal capacity. I want to put everybody at ease. This is a complex issue. This is a very political issue also. And I think if we can speak freely and in a sort of on a brainstorming mode, it will be better for the conversation as a whole and for the results and the conclusions of the conversation. So let me start with very basic question. And Katharina, I will start with you. With the sort of jumping in on the main question, how would you define fair benefit sharing when looking at pandemics and especially the experience we've had in the last 3 years?
Thank you so much. And maybe let me start by saying that I'm a big fan of the Paris Peace Forum and its open and interactive dialogues, and therefore hope that we can make this as interactive here. I see a lot of experts in the room, a lot of diversity, different opinions. So the more engaging we can keep this, the better. Let me also say that this is a rather critical day for us, all of us working on the INB, because today will be the date of the publication of the negotiation text for the pandemic agreement. And so, the timing of this panel is from that perspective very, very good. So, to your question, a fair benefit sharing approach is, first of all, a key element to advance global health security, and really, in a nutshell, provides for inclusive and equitable access to products, tools. I come personally from the diagnostic perspective, and that always gets forgotten, but it's diagnostics, medicines, vaccines, and other tools. From a legal perspective, and I have our principal legal advisor here, I'm not a legal expert, but from a legal perspective, the term is used in two key instruments and stems from that. First, the Convention on Biological Diversity, and B, the Nagoya Protocol. And both refer to fair and equitable sharing of the benefits arising from the utilization of genetic materials. So that's a mouthful, and happy to dive into that. But I think most important to say, that the language in these two instruments does not refer to any transactional relationship or movement between the provider of genetic materials and the recipient of genetic materials, but but much rather speaks of a global good benefit. So it's really very much about affordable medical products for those in needs. And so such a fair approach ensures access to products based on public health risk, not just on purchasing power. And that's very important. So I repeat that. Access to products on public health risk and not just on purchasing power. And that's, of course, all of us who have experienced, what happened during COVID will see, Dr. Tedros and I, we got desperate calls every single day from heads of states, from ministers in lower income countries who, struggled and had no access to vaccines and were not able to even vaccinate healthcare workers or the most vulnerable populations, and only were able to start doing so when in other countries children were offered vaccine, a much lower risk group. So this public health risk, I would say, is a central element of this discussion. And the negotiations we are in, I think, very much center around that, because that difference or divide in access has created a divide in trust and a trust deficit that we are struggling with until today. And it makes our negotiations on the pandemic agreement harder than it should normally be. So, last not least, I want to say, very practically, what this means is, member states are drawing from a couple of experience. For example, the pandemic influenza partnership. And what they're looking at when they do so for this sharing approach, fair benefit sharing approaches, they're discussing, for example, access to timely access, right? The timeliness of the access is extremely important. Timely access of a certain percentage, could be 10, like it is in influenza, to 20% of goods, that are critical to respond to the pandemic for those in needs. And usually that is done on a tiered pricing basis, i.e., could be, for example, at cost or a donation for low-income countries or different terms for other countries. But that concept of ensuring timely access to those at public health risk is a core element of it. So I think I'll stop here from that.
Thank you, Katharina. I know lots of things already. Let me turn to you, Siam. So we know evidently that there's a value in the genetic material that is shared. The problem is to assess the exact value of it. And of course, if we want to incentivize the production of more genetic material to have a larger sample of potential, for example, dangerous viruses, we need to put some kind of price tag on it or recognize that it does have value by inserting in it to a process. So how would you characterize the value generated from scientific data and scientific discovery used in pandemic preparedness and response?
I'm glad that we're kicking off this conversation by establishing a common understanding around definition and framing in this space. I think, as you said, and all of us here understand that access to genomic pathogen data is critical to the development of COVID vaccines and other countermeasures. And that a lot of that data comes from the Global South, comes from institutions in the Global South. So there are notable examples as early as March 2020, the first SARS-CoV-2 genome sequence was sequenced in Nigeria. The October 2020 beta variant was identified in South Africa. So there are numerous examples for how a number of institutions in the Global South were at the cutting edge and the leading edge in this space. So I think it's important to frame the question here in the context of moral responsibilities and obligations, which I think complements really what you said, Dr. Boom. the issue of access and benefit sharing is both an ethical and moral one, but also a very practical one, a question of policy and politics, of power dynamics, huge implications for economic productivity, but also, and most importantly, of access to life-saving health security commodities. I think that has deep implications for our commitment to equity and social justice if we do mean that, if that is very much a commitment and we want to realize it. So I think it begs the question that if the value that is so critical to scientific discovery is a huge part of it is generated from the global south. And if we incentivize open and rapid data sharing in this space, then I think it's critical to think about what are our obligations in return as a way to acknowledge such value. So I would argue that there is an obligation for reciprocity in this space. And I think that benefit sharing mechanisms are a practical tool, a tool that needs to be developed in collaboration and very contextual to the country or situations in play. And I think that is an actual mechanism where a number of players can actually realize some of these commitments that we have made in global health.
Thank you. Francesca, Magda, Anne-Claire, would you like to, I will have specific questions for you after that, but would you like to jump in at this point on some of the aspects of what Katharina and Siam said? Francesca.
Yeah, maybe just to say it's for me it's this notion. I mean, you said we need to agree and or define these notions of fairness and what is equity and fairness, and then we're talking about this. If you want, of a fair benefit sharing mechanism in a way. And for me, I think a fair benefit sharing mechanism will be necessary only a very, very small part and component or the broader issues of how to achieve equity and fairness and global solidarity following a pandemic and a health emergency of the sites that we have seen with COVID-19. So for me, like regardless of the ability and willingness of a country to share, whether it's genetic information and sequencing information or samples, regardless of that ability, there should be equity of access to medical countermeasures, to products, and so forth. So it is true, and you did mention that it's not really a transaction, even when we're talking about the pandemic, influenza, protocols and the mechanisms, but still there is a little bit that idea that if something is given, then there is something in return. And I think when we talk about equity more broadly, we should probably take it a little bit from a much. How do we define equity, regardless of or whether there is any, information which is given and what one gets in return. So I think this is more maybe a philosophical considerations, but I think we should definitely think of a possible mechanism like the fair benefit sharing mechanism as one very, very small part of what is the broad issues of addressing fairness.
Absolutely. Anne-Claire.
Yes, thank you very much. First of all, thank you very much for convening this panel. Of course, benefit sharing is a major element of the discussion currently underway at WHO. Actually, I'm the French ambassador for global health, but also the French negotiator for the pandemic agreement within a European framework because we have a mandate for the European Commission. Actually, I would like to jump in what you said. I totally agree with what you said, Francesca, because we talk about solidarity, equity, benefit sharing, but benefit sharing is just one part of the equity item and the equity concerned. Benefit sharing, we We spent a lot of time on it at the INV, and we can understand why, of course, but it's not the only aspect of equity, and we shouldn't forget it. Second, we need to learn from the lesson, especially from ACT-A, because, of course, the question, as Katharina mentioned, is to have timely and equitable access to medical countermeasure. And if we look back at COVID-19 crisis, we had ACT-A. Maybe it was not perfect, but it was one very rapid response. We organized an assessment of ACT-A, so we need to take into account the lesson learned from ACT-A, especially when we talk about medical countermeasures and equitable and timely access to medical countermeasures. And of course, we are talking about a pandemic agreement, which is supposed to be adopted in May 2024, but if we have a pandemic next month, what will happen? That's why in G20, an interim medical countermeasure mechanism has been negotiated, just to be sure that we have something to ensure timely and equitable access to medical countermeasures. And based on ACTA, the lesson learned from ACTA. So we shouldn't forget it, actually, these two aspects. Benefit sharing is not everything about equity. And yes, we will have the pandemic agreement. We need to have a pandemic agreement. But if there is a pandemic next month, we need something else, anyway, an interim. My last comment is about incentives and the data, as you mentioned. If we want innovation, especially for medical countermeasure, that means we need access to data, and especially about pathogen sharing. If we don't have pathogen sharing, we cannot innovate and we cannot have medical countermeasures. So the link is between sharing pathogen and benefits and sharing benefits. And it's two pillars, otherwise it doesn't work. And again, we shouldn't forget it. I'll stop here and I will come back later.
No. These are very, very, very interesting remarks. And I take also the point about this being one part of the equity debate more generally at heart. However, it seems to me that we still have a discrete problem, which is basically the creation of therapeutic countermeasures that are based precisely on these data. And so, unlike, say, for example, ChatGPT going around the web and scanning everything in order to create value, here there's a specific type of information that is given by only, ideally the place where the virus appears first or second or third. And so there's an additional element of inequity, if you'd like, in this. And there's also a specific problem to focus on. So while I accept that it's part of the broader equity problem, I think we still have this specific question in mind. But perhaps I should get now Magda into the discussion. Mrs. Minister, sorry if I refer to you as Magda, but Mrs. Minister, could you tell us, scenes from Guinea-Bissau and perhaps seen from the south in general, what are your reactions? What should be the objectives and perhaps the main characteristics of a system that would ensure fair benefit sharing?
Thank you. You said we are discussing on how personal capacities and we are allowed to be politically incorrect and say things. I think when we frame the conversation around benefit sharing, our starting point seems to be not right, because we are looking at the benefit as a finished product which is preventing a disease or curing a disease, which needs to be shared with those who cannot afford it. But actually, when the genetic material is shared prior to producing the product, there is a benefit, a huge benefit that has been shared there. Think about oil, which comes from offshore to countries that need it. So the benefit starts somewhere else. So I think when we are discussing, it's like we are giving back, but actually before giving back, someone has given something before we produce the finished product that will benefit everyone. So thinking about how do we calculate the sharing, I think the starting point should not be with the finished products. We need to consider the raw material as also something that has been shared for others to generate benefit. I think the second point I want to make about this is the governance that facilitates this conversation, the dialogue we are having right now, needs to be taken to other places. I appreciate this consultations which are happening here in Berlin, but I think we shouldn't see the recipient countries only from the perspective of beneficiaries, but rather participating in the generation of the good that will benefit humanity. If we move from that perspective, I think we will have a different mindset to go about it. And I think solidarity is also a concept that should not be seen from top down, from north, south, but I think solidarity is something that should be shared across. If we work, it may look philosophical, like it was said before, but I think if we start or if we continue this conversation, or we create scenarios where we look at some of these difficult pieces, equity, ethics, social justice, from different perspectives, I think we can generate scenarios that will probably give us options for this very difficult conversation we are having. And then finally, my third point is, I think we have good examples from non-pandemic situations, which can give us lessons for going about extreme situations like, for example, a pandemic. I think we can look back at the HIV/AIDS scenario. We can look into the HPV vaccine. There are many examples for that can give us good lessons from the past and help us navigate this complex conversation to the future. Thank you.
Thank you, Magda. So I was thinking of various analogies, and I mentioned ChatGPT in the sense that, for example, ChatGPT will feed itself on the work of writers, creators, graphic designers, and then will compete with them with their own material having been digested by the system. There's a huge copyright issue, and they can consider themselves as not as beneficiaries of ChatGPT, but really as co-creators, right? Because their creation has been used in the first place. Another analogy that we worked on at the Paris Peace Forum when we worked on fair benefit sharing was in the soccer world. So the FIFA model is something that we worked on. So you know that many soccer stars, football stars, as we say in Europe, are coming from clubs from around the world, especially from Africa and from other places. And so, of course, it's very unfair when a club invests in a young player for 3 years, 5 years, 6 years, breeds him, generally it's a him, and then he goes out to Manchester United or to the PSG, and then and then the club, having invested in that person, doesn't make any benefit. And so FIFA has created a system in which clubs from where these stars emanate, where they came from, are rewarded. And so it's more than just solidarity, and that's perhaps one question that we'll have to tackle. It's more just than solidarity or ethics. It's also a public policy, if you'd like, or it's a policy mechanism that recognizes the value of discovering talents and breeding them. And so I think it's another analogy that can help us think about that, and also can point to the fact that we all have benefits to get. I mean, the North and the South, if we can use such crude characterization, in finding new pathogens, decoding them, and then creating the therapy coming from there. So thank you, Magda. Katharina, I was seeing you reacting. Do you want to jump in at this point?
Well, I was just actually vividly agreeing with what has been said on the co-creation and looking at moving away from this notion of beneficiary, because I completely agree. But I also wanted to add that you talked about what is a true solidarity mechanism, and just wanted to say that from my perspective, as you also said, that goes far beyond, fair benefit sharing, and, to bring it back maybe from the philosophical to the more practical aspects, that means, as we would say, or would have said during Act A and COVID times, bringing arms or shots into arms, not just vaccines, right? And it's not about providing a fish, but a fishing rod. And so what it means for countries is that it's very much about, a more holistic approach to capacity building, regulatory capacity building, supply chain capacity, surveillance capacity, to be able to have the, to be able to detect pathogens early. It also means empowering countries for local manufacturing, local research, and so, I would say beyond benefit sharing, we're talking about much more holistic approach that empowers all parties and will get us to where we need to be.
Mm-hmm, mm-hmm. Could we address, perhaps now, before perhaps we get into the weeds of how such a process can be put in place, or what we can imagine as a public policy, international public policy process, into the power dynamics that exist. Ambassador Amprou, you mentioned earlier the fact that this was closely related to the ongoing negotiations. Could you tell us a bit more about how this is framed in the context of these negotiations, and what are the main players and their positions?
Yes, actually the process in WHO and the INB is a very specific process. I don't have a long experience, so for me it's a very specific process. But we have the INB with every member state, 194, and with a bureau of the INB with 6 persons, one for each region. So it's well organized, actually, and it's very, very useful for everybody. Of course, it is an international negotiation. So, of course, sometimes it can be difficult because these negotiations are also affected by political issues, of course, and we can see it at the INB, in G20, and at the UNGA in New York. Of course, the geopolitical context is a major element of the context, so we cannot avoid it. But when we talk about global health and pandemics, I think that everybody can understand that we have an added value to have this pandemic agreement, and everybody, even in the global north, needs this pandemic agreement, especially because we know that we will have another pandemic. The question is when. And we need a global response. We need first to prevent, And for France, for the European Union, it's very important to focus on prevention. We need to invest first in health system and in prevention with a One Health approach, with interdependence between health, animal, and ecosystems health. We need to prepare especially the medical countermeasures mechanism, as we mentioned, and we need a coordinated response if we have a crisis. I think that even if there is a geopolitical context and crisis in the room at the INB, everybody can understand that we need it. I think there is no debate about that. Of course, the question is how, and actually, we have political commitment. This political commitment, even with this geopolitical context, we got it already. The question now is much more technical, actually. When we need to go into the details, what does that mean prevention, One Health approach? What does that mean timely and equitable access to medical countermeasures? What does that mean capacity building? As you mentioned, I totally agree with you. What does that mean? So it's something like we have the geopolitical context, the political commitment, but we need technical discussion. For the technical discussion, we need trust. You mentioned it, we need trust, we need discussion, and of course, with 194 member states, it's quite difficult. But we need an inclusive process, and it's what WHO is doing with this process, and it is inclusive. But we need also stakeholders, and it's exactly what we try to do, because it's very important to have stakeholders involved in the process. So, of course, it is an international negotiation with member states, because at the end, this accord needs to be adopted by member states and ratified. But actually, it must involve many, many partners and civil society, stakeholders, quadripartite when we talk about One Health approach and so on. So it's a complex process, but we can understand why it's complex, because we are talking about a complex issue. But we need trust, and we need to have something adopted in May 2024.
Mm-hmm. Yeah, the issue of trust was mentioned several times. Magda.
I think what Ambassador Amprou and related to your question, we are here talking about accountability, really. If we have a mechanism in place, a governance framework to regulate all this system for when a pandemic strikes, who holds who accountable? I think this is the most difficult element in this conversation. And if vaccines are not shared, are not made available, medical countermeasures are not made available, so what? Who is held accountable and who holds who accountable? Probably this is where incentives for becoming accountable need to be embedded into the process. But what it is that will be a good enough incentive for people to be willing to share, willing to take care of those who are, let's say, more vulnerable when a disaster strikes. I think these are some of the fundamental. Can we identify incentives for that? Can we come up with an accountability mechanism that really works? I've not seen one in this world that has proven to be good enough. And probably the third challenge with the incentives and the accountability, the trust issue. which is eroding. The trust is being eroded every single day. The more we move towards Christmas, the less trust we'll have between nations. Maybe Father Christmas will bring some trust but we desperately need more trust among partners to be able to move forward with the accord and the other instruments that we need.
Absolutely. When we conducted research, and Gabrielle, who is here, conducted research in South Africa and Zimbabwe, we were able to feel that lack of trust and also the damage created by the sharing, especially of some of the variants of COVID, without any return. And so we could touch very concretely by the refusal of some actors to even talk to us when we were not accompanied by African actors about this experience. So bad was the burn, I would say. So let me turn to Francesca and then Siam on that issue, but also I'll have a question for you about identifying the actors, in the sense that who are we talking about exactly in terms of the potential beneficiaries? So who detects the pathogens? What are these surveillance networks? Are they hospitals? Are they, we're also talking about Zimbabwe and South Africa, but are they states? Are they governments? Or are they networks of medical facilities? And we know that there's a lot of sharing of data that happens spontaneously between them, and sometimes they just sharing because that's the ethos, that's the culture of it. So identifying them, and then identifying, I would say, in the north, who are the actors? Are we talking about governments here again? Are we talking about ministries of health? Are we talking about companies creating the countermeasures or others? I'd like to sort of elaborate a bit into that. But Francesca, the floor is yours on whichever of these questions.
Look, it's lots of things. It's very difficult to answer this question of who are the beneficiaries, because I think it was mentioned in a way. So many actors are beneficiaries. It's almost like the entire globe. It's a beneficiary one way or another. So it becomes very, very difficult. But I think in this discourse and discussion on trying to look at fair benefit sharing, identification of solidarity mechanism and everything, one issue which is a difficulty, including identifying then the specific beneficiaries and how should that be perhaps be rewarded or encouraged and incentivized and so forth, is that there are huge tensions between what is a global solidarity on the one hand, which obviously would see the availability, the sharing of data and information as widely as possible in order to accelerate the innovations and the production of all countermeasures, also the production in terms of manufacturing and then the equitable distributions. That's what we all want in terms of global solidarity. But there are enormous tensions, and we should just acknowledge them, between that goal and the national interest and politics, and how very often national governments need to and are accountable first and foremost to their immediate voters. And therefore, it's very, very difficult to have that perhaps explanations of how to reconcile that global solidarity goals and approaches with responding to what voters are expecting for, which is just to, in this specific case, having countermeasure whatever available for me first. That's and that's a reality, unfortunately, that politicians do face daily. They are elected by voters in their own country, and they are first of all accountable to their own countries, and that it's a huge tension, which makes it very difficult then to define, like exactly how do we, define the beneficiaries, and how do we perhaps reward sufficiently and so forth. It becomes very difficult, but there is also the business interest that needs to be taken into account, that obviously they're fundamental for developments of the countermeasures, but there is also a concern, including the governments have to make sure that there are sufficient rewards for the industry to continue to provide also productive capacity and manufacturing capacities also into the future. And so, I think we should acknowledge all those tensions, because they're still not resolved, and they're at the very core of the fact that we don't have yet, mechanism or a sharing or a solidarity agreement, it's really inherent on the fact that there are these different tensions which are somehow inevitable. Perhaps one issue to solve it's to really look at each of the different aspects separately and just see how do we address it. How do we address the incentives to make sure that there is sufficient sharing of data, information, scientific knowledge, and that when information is shared openly, then a country is not penalized with border closures and trade restrictions, for example. Like, can we address that in a way? And probably needs to be addressed in specific incentivizations and accountability mechanism for that. There are then obviously issues that relate more to, could we perhaps have a way for sharing pathogens and the informations from those pathogens in a way that accelerates the delivery of new innovations? How can that be recognized and encouraged, but not with expectations necessary that this is linked in a transactional way to having back the countermeasure, because obviously the countermeasure will need to be available wherever they will deliver the best benefits, and it might be even in other countries than those where the initial pathogen was discovered, for example. So the mechanism needs to be much more global. And then there is the issues of how do we incentivize sufficient production of medical countermeasure, necessary pass through addressing issues of mechanisms for knowledge sharing and transfer of knowledge and technologies, and how to reconcile that with IP issues as well. So there are lots of different pieces that needs to be addressed to achieve an accountability solution in the end. Sorry, I spoke too much.
Yeah, and Claire, before I get to you, I wanted to get back to Siam rapidly, perhaps on this question of actors or on another one.
Yeah, so many threads to pull, but first I wanted to say excellent analogy with the soccer football players, because I think that we might reach the masses on benefit sharing using that. To answer your question and amplify some of the things that Magda has said, I keep going back to the question of power dynamics and where do the benefits accrue. Let that be our guiding light. A lot of the challenges that we see today may be new or have a different flavor, but they are essentially things that have plagued public health for a long time. And Magda mentioned the HIV/AIDS pandemic as a glorious example in that regard. So I think thinking about power dynamics, thinking about what are the uncomfortable things that we keep not addressing in a meaningful way or in a constructive way, and also thinking about the long-term commitments that need to be made in building surveillance systems that are robust, in building infrastructure for surveillance, development in country close to the last mile in manufacturing, and what are the implications to do that in a meaningful way, which everyone here has addressed. So I think thinking about benefit sharing beyond the attributions or making sure that everyone is cited on a paper, what are the really difficult things that we need to happen, and where is the tensions that you brought up? Vaccine nationalism, where it's somewhat understandable in a time of panic, but I think we need to check ourselves. What are the things that we need to do differently? Where are the push and pulls that we need to address? There's clearly commercial interest in this space, but I think at some point there is a line to be drawn between profiteering versus achieving global health equity or protecting the planet or protecting our health. So I think there's quite a few things in tension. But if we are if we mean open and rapid data sharing, if we have a commitment towards some of these goals that we say, I think if we don't think about long-term and we don't think about some of those difficult things, we'll just kind of end up continuing the cycle.
And Claire?
Yes, well, first of all, the reference to soccer or rugby is very painful for France. Because last night we lost for just 1 point at the Rugby World Cup, and congratulations to South Africa. More seriously, I think there is one actor who has not been mentioned, is the population. Why do we need medical countermeasures? Because we need to protect the population. It's a matter of public health. And we shouldn't forget the population and the question about information and misinformation, which is a major issue, a major concern we have when we talk about vaccines, sharing data, sharing benefits. So we shouldn't forget the population and the concern of information and misinformation. Just stop here.
Thank you. I'd like to get back to you, Katharina. I was very interested in what you said. So 2 points. One is, I still have in mind my question. I think it's relevant. That is to say, it seems we have an asymmetry of actors. On the one hand, we have what the jargon sometimes describe as epistemic communities, right? So scientists sharing data on chat rooms and in their own networks, etc. And so data is shared and is not, there's no price tag in that, and it's in the interest of science. And so you have these scientific networks on the one hand. And then on the other hand, you have other actors, national governments, or companies creating vaccines that are very different in the way they use this. And so whereas you socialize the findings and the information, you privatize the end result. And so we know it's co-creation, but only one part of the process of creation is really sort of valued and has a price tag to it. So one of the questions is how do we go beyond the disparity of actors involved in that whole chain? And I realize I'm oversimplifying this, but we see that these differences between actors is important. And Katharina, perhaps more specifically, I was interested in what you said about benefits, because of course one of the questions is if we agree that there's a value to the genetic material that is shared because it's the basis for creating countermeasures, etc., then when we think about the benefits that might in the end come to the ones that have put forward the genetic material, as you said, and I wrote down the list that you mentioned, providing them with a fishing rod. So you mentioned capacity building, so not only vaccines, and I think that's really important. Of course, it's about public health, but it's also about creating the capacity to better serve that public health. And so you mentioned capacity building, the whole supply chains, the surveillance capacity, which, by the way, is in the interest of the North, so to speak. So it's perhaps less about solidarity than about interest and local research. Could you elaborate perhaps a bit on that and on other points that you might want to react to?
Yeah, so maybe first a note on the stakeholders, because I think that's really important. You know, it's the member states who negotiate, and we as WHO Secretariat serve the member states. You know, I think a bit harder to fully integrate in the process is the innovation players, as you mentioned, right? The academia, the private sector, but also communities and civil society. And then last not least, I feel the youth needs to be fully brought into this. Because as Dr. Tedros always says, we are the generation who lived through this pandemic, and it's our responsibility to negotiate a generational agreement that really does two things. It safeguards the future and it strengthens global health. And we do this on behalf of our children and on behalf of the younger generation. And so it's to bring it back to a nutshell, while it's member state negotiating on a day-to-day basis, this can only succeed if we work together to bring all these stakeholders in. Then maybe just briefly on what you asked. I want to say, again, we will also only be successful if we create a win-win-win situation out of all of this. And so yes, the private sector, yes, there's commercial interest, but let's also not forget that most pandemics or outbreak situations we deal with are market failure situations, right? If you think back of Ebola, or if you think back of Zika, generally we have successes on the innovation side, but then very often products disappear after a short while, when the outbreak is over. And, a lot of the innovators, invest money and fail at the end, right? So there's not only successes, and I think what we've not touched upon very much yet, but is an important practical consideration, is risk assessments, right? For all stakeholders again, but including for everybody who innovates in this world. And so again, also based on what the other panelists said, analyzing concretely, what are the incentives, what are the wins, is critical because, frankly, we have 7 months left to get to this pandemic agreement, to get to this generational agreement. Very clearly, your name is Paris Peace Forum. We're not living in a world of peace right now. The geopolitical situation could not be harder. And to negotiate this agreement within the next 7 months is a challenge. Geopolitics is not on our side. Amnesia for this pandemic is not on our side, right? Clearly the political will is very much on a downhill track. So how do we pull back all the players again at the table and finish the job? I think that's what's key. And for that, it will need compromising on all sides, and it will need, we will need, based on the next negotiation text, to create from what currently is a bit of a vicious spiral, a virtual cycle that leads us in May to something on the table that all the parties we've just mentioned can stand behind and say, this is what we needed, and it doesn't give us everything we need, but it gives us enough to be in a safer world and in a safer place.
Thank you. I couldn't agree more. And as a matter of fact, the general theme of the next edition of the forum in November is seeking common ground in a world of rivalry. That is to say, how do we preserve areas of cooperation, such as on vaccines and data sharing, etc., in a world where competition has exacerbated, not only between the US and China, but also in other situations, and how do we preserve global governance from geopolitics, if you'd like. And so that's the general theme of the next forum, to which you are all kindly invited. That's on November 10 and 11. That was for the advertisement. Now back to the panel. We have about half an hour left, and I wanted to keep 1/3 of that panel for a discussion with the public. Generally, my role as a moderator is to say, make sure you have a question and that it's short. Here, I think we can have a larger discussion because, once again, I'm sure there's a lot of expertise in the room. So comments or opinions are also welcome as long as they're kept short. I know there's a microphone circulating here in the room, and so we will take batches of 3 interventions, and we will start with the person here in the 4th rank, and then we'll move to the 1st rank. And could you simply introduce yourself when you're asking the question? Thank you.
Yes, my name is Fatima. I am representing the International Pharmaceutical Student Federation. And my question is, I have been to many sessions these 2 days, and a lot of them talk about how to solve problems, how to get medication out, how to reach the global south. But the problem is, in my opinion, or a factor that should be put in is that a lot of the reason for why new medications don't get to the global south is because it's not profitable for the pharmaceutical industry. And we talk about innovation in that regard, or like IPR and patent problem. We talk about it, but do we have a solution that we can implement? Like a lot of things is just. Sorry to but it's fancy talk, but nobody has presented a solution for the problem we have now. How do we solve it? Yeah. How to make it profitable at the same time, so that the pharmaceutical industry does see something good in it, but how do we also get the middle income countries or lower income countries to have incentive to actually buy it? Yeah.
Absolutely. Thank you, Fatima. So next question here on the first rank. The two persons here. Yeah, you can go ahead and start.
Thank you so much. You were saying that...
Do you mind introducing yourself?
Sorry. I am Smita Sadashivan from the Civil Society Alliance for Human Rights on the Pandemic Treaty. My question is, you mentioned that everybody would have enough good, something. And when we are saying in that context, what about the vulnerable groups? Like, for example, persons with disabilities need more targeted approaches, and it differs from the capacity building to the needs, and it is not only the, even if we take a disaster situation, a person is rescued, and after rescuing, what are the medications and what are the support systems required is not focused. Or while rescuing or treating the person, what are the systems, the support systems required, and what needs to be focused, that is not actually looked into by the system itself. And just rescuing on their own decision does not help the person, but it makes the person worse, especially for people with severe disabilities. And so in that context, or even a message, a knowledge sharing, when we say, for example, just the hand hygiene, the information on hand hygiene did not reach the deaf groups until somebody made a sign language video and shared it with them. So how are we going to tackle these intricacies so that there is equity and the message or the service reaches everyone? Thank you very much.
Thank you. And then the person next to you.
Thank you. Jorge Saavedra, Mexico, from AIDS Healthcare Foundation. I'm civil society, so I'm not going to be politically correct. Is that okay?
Go ahead. You'll be my guest.
So my first question, I have two very short questions. One is for Magda and Katarina. Or probably for anyone, because there was no mention of civil society in terms of incentivizing early warnings. But I must come back to when Ebola broke in Guinea in 2014, the first early warning came from MSF, not from governments, not from member states, and they were not taken seriously until there was a recognition by a member state. In the case of COVID-19, looks like there was an early warning by Taiwan, but it was not taken seriously because it's not a member state. So that idea that everything needs to come from governments looks like is not incentive enough to be early warning. My second question is for Anna Claire and Katarina, because you say we need a pandemic agreement. So by consensus, it means any kind of agreement, not a good agreement, but any kind as long as it comes from consensus. So it can be very weak or probably a political declaration of good intentions because that was the consensus. Why it needs to be by consensus? Why not be good pandemic agreement instead? Thanks.
Excellent. Thank you very much for these specific questions. We'll just take these batch of three questions first, and then we'll get back for a second batch. So we had questions on the patent problem, or the fact that it's not profitable to produce countermeasures for markets that are not solvent enough, if you'd like. First question by Fatima, then a question on specific publics and people with disability, and then the two questions directed to Magda and Katarina in particular on the role of other actors in early warning and also the quality, not just unanimity of the pandemic treaty. And so I suggest we go perhaps in reverse order and start with you, Magda. You can pick any of these questions and then we'll move to Francesca and the others.
Okay, thank you. I think on the last point, of course, civil society is a huge role to play, and I think it's part of the stakeholders. There was no intention of leaving civil society out. I think the issue of consensus, we can have a bad accord by consensus, and you said a good accord, a good agreement. There will be no agreements if it has to be good. So there is a problem here, and unless everyone agrees, or majority agrees, but Katarina will be in a better position to address that. I think agreements will be difficult. For it to be good, we really need to give and take. For the market failure in low and middle income countries, I will only say one thing. This is a very complex issue that goes beyond pharmaceutical production and private sector and governments. This is a development issue. We have issues around trade. We have issues about finance, which, if they are not solved, we will continuously have low and middle income countries' market failure. It's a much bigger problem. Think about neglected tropical diseases, and you'll get some of the answers. I'll stop here. Thank you.
Thank you. Francesca.
So on the issue of disability, to me, it's a broader question about the way the information is created and circulated that should be targeted towards the needs of specific population groups, such as those with disabilities. And I think it's an issue which is much beyond also just the pandemic discussions. I mean, people with disabilities have difficulties in accesses of services, in having equal rights and opportunities. So I completely agree with you. I do think, and I'm perhaps an optimistic, but there has been at least some movements in that direction. It's sometimes only focused on certain type of disabilities and not on the broad spectrum of disabilities. It needs to be worked through all actors, including employers, labor markets, and so forth. But it's completely agree with your point. It needs to be very targeted. On the issues of market failure in low and middle-income countries, completely agree. I mean, it's quite clear that we do need to work on the incentives mechanism for having knowledge transfers and development of productive capabilities in low middle-income countries. That's something that still needs to be resolved. We cannot say in absolute terms that there were no incentives for innovation. There were. We have been very, very quick in having products that have been produced, but with huge then associated inequities that we all know and witness. So I think we still need to work out on a better mechanism for incentivizing the productive capacities in low middle-income countries. Yeah.
Thank you. And Claire?
Yes, regarding the question about consensus on the pandemic agreement, actually, it's an international negotiation, so we need win-win. It cannot be a top-down approach. It doesn't work because this agreement needs to be adopted by member states and ratified. So it cannot be a top-down approach. It's an international organization, international negotiation, and we need win-win. So that's why we said we need a consensus to be sure that everybody is comfortable with the pandemic agreement, which will be adopted. Regarding the question about industries and the access which is not possible because they are not profitable. It depends on what we are talking about. If we are talking about products, especially vaccines for pandemics and especially for the COVID-19, actually we shouldn't forget that facilities have been negotiated at WTO. So the first priority is to use these facilities. And if we talk about other products, we have many initiatives, such as UNITAID. UNITAID, the mission is to make drugs, products affordable for everybody. And we have other initiatives, such as Medicine Patent Pool, which promotes and supports the tech transfer, which is voluntary, but the tech transfer. So it's not only a question of IP, because sometimes we can hear that it's a question of IP. Actually, it's a more complex question, just because if there is no IP, there is no innovation anymore, so no incentives. So we start again with the first question. So it's a complex question, but we have many initiatives. Some facilities have already been negotiated.
Thank you. Siam, do you want to
just
pick on some of the
just
questions?
a brief comment on what has already been said. I just wanted to push back a little bit on the question that there is no demand in LMICs for global health security commodities in general. I think there is. I think it's an untapped market that would require a heavier lift and a different focus. But I think that there is demand, especially in infectious disease and in non-communicable diseases. So just a broader statement there. I also wanted to broaden the conversation when we talk about the private sector to beyond just pharmaceutical companies, which clearly play an incredible role, especially in a pandemic or an emergency, and there are some immediate countermeasures. I think the private sector has played an important role in innovating, in bringing on technologies that are a bit risk, and you touched a little bit on someone needs to assume that risk, and I think traditionally private sector actors have done that. I think they're also really suited to build capacity in country, build infrastructure in country if there is a commitment to it. So I think that there is an incredible role for the private sector. If anything, we just need to help articulate what that is. And then do want to push back that I think that there is demand in country. To the comment on disability rights, I just wanted to say that disability patient advocates have been incredible in this space, in pushing as part of civil society, and in pushing us to see things, bringing a different perspective that I think is often neglected. So a lot of people have touched on that, but I wanted to acknowledge it, and thank you for your questions.
Thanks. And Katharina, do you want a last word on the questions, or?
Yeah, very quickly. I wanted to give quickly the floor to Steve, but one sentence on, I completely agree that communities and civil society are utmost key actually for every step in the value chain. And that very much, I agree also on their role on early warning. That's why, in our work at WHO on pandemic preparedness and response, there is a focus on that specifically in one of 5 work streams, right? Because it's absolutely critical also when it comes to, for example, misinformation, disinformation management, right? I do think, in terms of, taking warnings serious, right? I think clearly there have been, in governments relationships, there can be issues, and it's our role to make sure that we can overcome that and we find the means to overcome that and take warnings seriously. I don't think Chikwe is in the room, but clearly our work on collaborative intelligence, right, and making sure that we detect the right signals early is also very much part of that. But, let me just super quickly give the floor to Steve on this.
Get the mic here.
Mic is coming. Hi, can you hear me?
Yes.
Hi, I'm Steve Solomon. I'm a lawyer at WHO, and it's the panel and the discussion has been incredibly rich. So thank you. Just to answer or to address, I think, two questions. First, on why consensus. This is often asked. WHO and the World Health Assembly, in particular, operates in general on a consensus basis. And I think there's often a thought that consensus means a lowest common denominator result. I think that can be the case, but I think there's a lot of global health instruments which suggest it's not necessarily the case. I think I'd start out with the WHO Constitution, which enshrined the right to health as a fundamental right. That was a consensus document. The Framework Convention on Tobacco Control, which has dramatically reduced tobacco consumption and has been adopted by 182 countries, also was a consensus approach. This is also true of the Pandemic Influenza Preparedness Framework, which has been not tested yet, fortunately. There has not been an influenza pandemic, but that was also a consensus. It doesn't have to be the case, but it's important to keep it in mind to safeguard against consensus being a lowest common denominator path. And then on the issue of WHO receiving the signals it receives about health threats coming just through member states. One of the great achievements of the 2005 International Health Regulations, in addition to being an all-hazard approach to health threats, was that member states decided WHO could get its information from anywhere. And that was a major step forward in 2005 to make that clear. So it's not perfect. Member states themselves, the reason I can say this is member states have said that. Member states said the IHRs should be strengthened. And that is, in fact, the process, the normative process that is running alongside, in parallel and in coordination with the negotiations on the pandemic accord.
Very interesting. Thank you. I didn't realize that was the case. Thanks a lot. So we now have time for a second batch of 3 or 4 questions, and we'll start with the gentleman here because he's closest to you, and then we'll move to the third round.
Thank you very much. I'm Antoni Plasencia. I'm from IS Global, the Barcelona Institute for Global Health, which is an academic institution. I don't want to divert from the core of the conversation, but when we're talking about early warning systems and challenges in terms of fair benefit sharing, I was wondering how other information systems, for example, mobility-related systems which have to do with phone communications or other healthcare databases, what are the provisions right now from the perspective of the pandemic accord? And my question, I guess, is to Katerina and to Anne-Claire. Okay, thank you. So just to be able to think beyond what is, of course, very important, but that also is part of epidemic intelligence and finally preparedness and response. Thank you.
Thank you. We move here to the persons in the third rank.
Thank you. Hi, everyone. I'm Asma Saidouni. I work in the regional office of WHO Eastern Mediterranean region. I have a question regarding how can we adapt these incentives of early warning systems for the fragile and conflict-affected countries. And we know that these settings are really quite vulnerable to re-emergence and emergence of infectious diseases. Thank you.
Thank you. And the gentleman next to you. Yes.
Thank you very much. My name is Dominikus Vogel. I'm from the Berlin Social Research Institute. And also yesterday in this room, we met to discuss the issue of this global accord. Sometimes it's called like the International Intellectual Property Accord. I think it's a crucial issue, but I want to, and we talked today about the trust issue, we heard about it. So I'm really curious to hear your opinion about, also in the room, like what level of trust do we need and where are we? And we still have 200 days, so if the threshold is like 100, that's the number we need to kind of like move over. Like where are we today, way beyond 100 or above that? Plus, the Paris Peace Forum, like we are not alone in that. It's there are people working also on global peace on a political scale, so we should think that as a teamwork. We work here also with the founders of the World Health Summit to establish a Berlin Peace Conference here, so we should think that as a global approach to really get this world better. And last comment is, I think the international community, the diplomats we have on the floor, is the best cohort we have for a long, long time. Most diverse, most people. So I think it's a real chance to really work on that. Thanks.
But Domenico, 30 minutes ago, I invited everyone to the forum, so, and that was serious. I was not joking. One last person, because we'll have only this batch.
Hi, my name is
Sir?
Mitch Wolf. I'm with Ginkgo Bioworks. I had a two-part question. First, Catherine at the beginning gave a definition of benefit sharing being, timely and equitable access, not transactional. And I'm just wondering, in the negotiations, is that a widely accepted definition? And also, second, so where genetic sequences fall. Genetic materials, I understand, and are well described, but genetic sequences, there's GHI, which is kind of a free cloud-based sharing mechanism. And I'm wondering what the discussions have been about genetic sequences. Thanks.
Thank you. So now we are going to get back to the panel, and then we'll start with you, Katarina, and finishing with Magda, and I want to finish with her for staying with her words. But first, Katarina, so we had a number of questions on how other information systems work, on how do we adapt incentives for fragile countries, a question on trust, what threshold do we need, where are we today, and also on the genetic sequencing there. So lots of questions and perhaps concluding remarks also, all wrapped in one 2-minute answer, if that's fine. Katarina, we'll start with you, and then Siam and the others.
Okay, so you asked all the easy questions, right? And but very valuable thoughts. Thank you so much for that. So maybe first, very quickly on mobile phones, AI. I mean, clearly artificial intelligence, is something, as our director of digital innovation would say, that will transform this whole landscape in health within the next 6 to 12 months, right? And there will be, massive opportunities, but also massive threats in terms of misinformation and disinformation around outbreaks, which is why the last G20 in India also set up a new initiative specifically on artificial intelligence and basically trust certification around that, and making sure that there are some joint standards against which we work on in health. And I think none of us today in this room is capable of foreseeing how this would look exactly. Huge potential clearly on the outbreak detection side, on the early warning side, but also huge risks associated for that. But not such a focus in the discussions of member states at this point, more taken forward through separate standard setting in the AI space. Fragile settings, I do think once we have a pandemic agreement, countries, and the community have to think about how to implement it, right? And clearly, the implementation in acute or chronic fragile settings will be most challenging, right? But that's when very concrete terms, for example, access terms in terms of, 10 to 20% of goods provided timely to every country, every low income country, to make sure that we can have the tools available in every setting, in every context, I think can play a huge role, right? So there, it's not maybe now so much about local production, but it's really about making sure that the tools get there when they need to be there. Then the trust, I think I've spent a whole moderated dinner last night on the topic of trust, and I think the next World Health Summit will also, focus and will have a theme around this trust, because the trust is broken between so many different stakeholders, right? I don't like very much the terms North and North and Global South, but I think it's also between the young generation and the older generation, right? It's a trust or distrust relationship between so many levels. And I do feel this is a complex subject, but in a nutshell, I think we've learned in this pandemic about the critical importance of behavioral science, about the importance of communication and information sharing and the means of doing that at all levels. So there's a lot of lessons that we need to take into account, including on the pandemic agreement. So I think I'll stop there because I've been too long.
You're feeling the pressure. Siam.
I'll be quite brief and touch on some of the last questions that were asked. And I'll also send us off with some homework and a hopeful note. A huge part of what I do is try to work with in-country public health actors that are usually embedded in the infrastructure of a country's public health system to set up routine genomic surveillance programs. And that is a labor of love for me, but it's also something that has immediate as well as long-term infrastructure building implications. And some of the guiding commitments that we do is that it is in collaboration with local partners, it is contextual, it addresses an unmet need, and it generates data through sequencing capabilities that can inform action in country, as well as the development, pushing the lines of scientific discovery, developing global health security products. So I think sometimes, and it touches to your question on fragile and vulnerable communities. If you have a surveillance system that works, then you're able to catch something early, that you can still do preventative methods, that you can still detect in time to address an outbreak before it gets to be at a higher proportion. So I think kind of going back to the basics, really embedding ourselves in the local, in our context, and designing interventions that address the unmet need.
Thank you. Anne-Claire?
Yes, regarding the question about early warnings, especially in fragile countries, is a question of health systems strengthening, especially in very fragile countries. That's why we decided to invest in the pandemic fund, which was created last year. And actually, the priorities for the first call, which was launched in April, was surveillance, laboratories, and human resources, especially for low and middle-income countries. And we try to focus on fragile countries to help them to implement and to strengthen the health system, because it is a key, actually, to prevent and to prepare pandemics. Regarding the genetic sequencing, actually, we need open databases. We have already databases, but maybe we can think about new ones monitored by WHO, for example, but we need this basis with open data and with the security system, which is always the key questions. The last point is about trust. I think that the best ally of trust is scientific-based method. With that kind of method, we can have trust.
Thank you. Francesca?
Yeah, on the issues of early warning system, for me there is a wider point about having really the data system and information infrastructure in countries, and to me, and I completely agree on the benefits and also the risk of artificial intelligence. Artificial intelligence is ultimately based on data that is used and plugged into algorithm and everything, and the data systems are actually quite poor, even in a number of high-income countries. And we have seen an acceleration through COVID is perhaps one of the only good things that come up in terms of reinforcing the data, the linkages capability, the ability to generate real-time informations. And I think if we are talking about early warning mechanisms, we do need to create those basic public goods, which are the data systems in countries. And on trust is obviously a huge topic, and I think I hope that discussion like what we're having today can help and contribute to create trust. Certainly more agreement or discussions on what do we mean by issues like equity and solidarity, is how to achieve it, global public goods, what is the global public goods, certainly can help move the conversation. But we must all address the issues of misinformation. It has been come up in the discussion. Without tackling that, it will be very difficult to build and sustain trust.
Thank you, Francesca. Magda, the last words are for you.
I think everything has been said. But just to say that these conversations and the negotiations show that health is highly political, and we cannot really disassociate it from what's going on in terms of geopolitics, geoeconomics, geoclimates, if I may use that word, and COP28 is coming. That's also another moment where we will see what kind of tensions will alleviate or become even worse. So, but I'm still hopeful, and I think between now and May, some of those leaders will understand that going back to the dialogue table is the only solution for peace and the only solution for progress, and then maybe we'll be able to have a pandemic accord which will not be the lowest common denominator, but a strong one to help us move forward.
I think this was a perfect conclusion. Please join me in thanking the panelists for a superb discussion.